What I want to do in this talk is really focus on work that I've been involved in to understand how tobacco companies have undermined public health efforts to reduce the appeal and how misleading the cigarette pack is. It's important to keep in mind that the tobacco companies are fueling the tobacco epidemic, and that these companies continue to boldly market their products and aggressively fight efforts to protect health. So I want to move on and focus on the rest of the presentation, where I'm going to tell you about what tobacco companies have done to modify cigarette packaging to undermine public health efforts to make the pack less appealing and less misleading. So first, I'm going to discuss the issue of addressing the fraud of light and low tar cigarettes. Second, I'll discuss removing flavors that make cigarettes attractive, including menthol. And then I'll talk about the challenges in putting effective health warnings on packs. So what tobacco companies did to create their so-called light cigarettes is they put teeny tiny ventilation holes in the filters of the cigarettes. So when the smoking machine inhaled, air came in, diluted the smoke, and it resulted in lower tar readings on the smoking machine. Now, the problem is that humans are not machines, and the human brain knows when it's not getting the nicotine that it's looking for. So what smokers would do when they inhaled is they'd either cover the holes with their fingers or with their lips, or they would take more puffs and more frequent puffs and deeper puffs to try to extract more nicotine from the cigarette. So it took about a decade for public health to figure out the fraud of light and low tar cigarettes. And when we did, countries started to ban or prohibit the use of light and low tar descriptors on cigarette packs. So when countries did this, what did the tobacco companies do? Well, they complied with the letter of the law, and they removed the specific words, like light, that they were told they needed to remove. But instead, they started using colors, numbers, and new words to communicate relative strength and to try to communicate which cigarettes might be safer for those smokers who are looking for a safer cigarette. So we went from having Marlboro Lights to a very similar pack, looks exactly the same except without the word lights on it. And sometimes they even added the word gold to the pack. So smokers went from smoking Marlboro Lights to smoking Marlboro Golds. In the paper that we published on the study, we concluded that removing light descriptors from cigarette packs is likely not sufficient to prevent the use of the package to communicate relative strength and implied health benefits. So in other words, the public health effort to try to address the fraud of light and low tar cigarettes did not end up working very well because tobacco companies figured out new ways to communicate the relative strength of the cigarette. I want to move on now to the second topic, which is efforts to remove the attractive flavors from cigarettes, including menthol. Based on past experience, we expect that tobacco companies will tend to push the boundaries. And they can test and learn from marketing strategies that they use in countries with lower levels of regulation. So we were wondering if tobacco companies are experimenting in other countries with how to circumvent bans on characterizing flavors. You'll likely see a pattern in these findings when we think back to the findings around light cigarettes. So we found that once again, tobacco companies are adhering to the letter of the law. So in Nova Scotia, we didn't find any menthol brands. It's a very small province, and they were the first ones to ban menthol. In Alberta, before their menthol ban, we had 16 brand families that had menthol packs. And after the ban, only 4 brand families had what we called menthol replacement packs. And these menthol replacement packs, what happened was the descriptor changed. So before the ban, it said menthol, and after the ban, it said green. So the last topic I want to cover is how tobacco companies undermine public health efforts to put effective health warning labels on cigarette packs. Now, here are just a few of the beautiful packs that we've bought in various countries. Some of them are here as well. The pack is clearly a marketing device and it communicates aspirational brand imagery. So far, Australia is the country that has gone the furthest. So Australia implemented what we call plain packaging at the end of 2012, and I have a plain pack from Australia here. So this is what Marlboro Reds look like here in the United States, and this is what Marlboro Reds look like in Australia. This is the front, this is the back, and we've got an extra prominent warning on the side of the pack. The brand name is written in a standard font on a green-brown background. So all brands look the same, it's just Marlboro Red that would change. So this type of plain packaging helps remove the marketing potential of the pack and begins to convey that this is truly a harmful product. Now, plain packaging is important, but we also have to think about standardized packaging. That is packaging that is the same size, shape, has the same opening style, and with cigarettes that are the same size and look. Both plain and standardized packaging are needed to address the attractiveness and marketing potential of the cigarette pack and to better implement our health warning labels that are really important to communicate health effects to smokers. So we have to think about a standard size, shape, opening style, and then plain cigarette sticks that are of the same size as well. So in summary, these examples of addressing the fraud of light and low tar cigarettes, of removing attractive flavors from cigarettes, and of putting effective health warning labels on our packs all sort of show that we're often 2 steps behind tobacco companies. But I don't want to leave you with the sense that tobacco control efforts are ineffective, because that is definitely not the case. Indeed, tobacco control is held up as an example of public health area that has made a lot of progress quickly. So what I do want to convey is that it is important in our public health efforts that we are always vigilant regarding the disease vector. And secondly, that we continue to learn from what's happening in other countries so that we can write better legislation, for example, that gives fewer loopholes for tobacco companies to exploit.
Join us for our next Dean's Lecture, where we celebrate the appointment or promotion of a faculty member to the level of professor at the Bloomberg School of Public Health.